Great to be back on our first webcast of the year. Hi, everybody. Hope everybody's year is off to a great start, as ours is. And I'm very excited to be here to talk to you today about this topic, connecting the healthcare employee experience to the patients, this idea of the tie that binds. Usually at this point, at the beginning of the webcast, we kind of run over our bona fides as speakers, run over why we're here, why you should be listening to us. I'm doing this a little bit differently today because this topic that we're focusing on, and even in a more general sense, the healthcare industry is one that is of a particular interest to us. It is dear to our hearts, if you will. And I thought I would just kind of frame out how my personal experience has really led me to that place, and us as a company to our work focusing a lot on the healthcare sector. I started my professional career as a clinician. My training and my degrees in clinical psychology, and so I spent time both during my training as well as a postdoc working as a clinician in both a small clinic as well as big hospital settings, experiencing firsthand. This is quite a few years ago now, but I experienced firsthand a lot of the challenges that have really only grown stronger in the healthcare industry in terms of the frenetic pace and the pressures that employees in that system can work under. Of course, for the last 25 years now, I've moved into more of a applied behavioral scientist, doing research looking directly and specifically at issues related to engagement and well-being and productivity in all sorts of contexts, and being able to do both the basic science research into that area to learn what are the key factors experientially that drive great experiences at work, and then applying that in a lot of different contexts with companies. And certainly healthcare has been one area of practice that we've been very proud of over the last 20 years. But the third thing I want to mention today, which is sort of atypical for a webcast like this, is that I also have a lot of experience, as we all do to a certain degree, being a patient. And in my case, more than most people my age, I would say, in that about 20 years ago, I was diagnosed with a chronic illness. Not life-threatening. It's a chronic inner ear condition that at the time nobody knew about. It was only around the time I got it that the first research scientists were beginning to look at the syndrome I had and try to understand what was going on. But it is a syndrome that is highly, well, not life-threatening, is very highly debilitating. It affects your balance, chronic imbalance, problems with sound, causing a sense of motion, being able to hear so acutely that you can hear your eye moving in its socket as you turn your eye. Very weird set of symptoms that was really troubling, particularly since nobody knew what it was. And I just want to tell a little bit of a brief personal story that will set us up for what I want to get into today in the webinar, which is this idea of employee experience and patient experience and how intricately those are tied, and what we need to be doing, I think, much better, and what we can do much better as healthcare organizations for both our employees and patients. On a particular day, needed to go in for some testing. It was very difficult for me to travel with this inner ear condition. I fought my way through an hour-and-a-half commute to get to a location to get a brain scan that I was there to get in order to rule out something that would have been even much more serious than what I have, probably life-threatening. I was terrified. I was exhausted. I had done all of the necessary work, getting the pre-approvals, going through all the bureaucracy of healthcare, and I got up to the front of the desk, and I was immediately into a fight with the person at the desk and then some of the attending people that came out, because apparently, even if I had done everything right, there was a problem. There was a problem with the insurance. There was some bureaucratic snafu, and I was told, you can't have this test. You need to leave, reschedule. The next available date is 3 months from now, et cetera. And I was so distraught by this. I excused myself from the desk and went into the nearby bathroom and locked the door, and I just broke down. I broke down really uncontrollably, just sobbing. It was a point, a real low point in my struggling with this illness. And I'm going to come back and finish this story at the end of the talk. That's one of those little tricks to get people to listen to the whole thing. If you're interested enough, I'll give you this cliffhanger. But the reason I want to pause here is I want to say that this story feels like I'm telling a villainous story about the healthcare workers. But I just want to say that having worked as a clinician and also having studied this behavioral science and having such a passion for healthcare, I feel as empathically towards the people that were worn out and unable to give me the care I needed as I do for me as a patient. And I've reflected a lot on that story because these are people that went into healthcare. By all accounts, the people that are there, they go into it because they want to help people. And yet the situation is that so many of people in the system, and of course, those of us who are listening today that are in healthcare know this, the healthcare practitioners, the nurses, physicians, depending on what stat you looked at, sometimes it's 2/3 are experiencing some symptoms of burnout, but about half are experiencing significant and substantial symptoms of burnout. And they're just not able to bring that commitment and to bring that care to the patients that they want to. This burnout just has massive consequences across the board, right? For all the challenges in healthcare that we have, this problem of burnout and overtaxing the system and the very people that are there and who are dedicated to helping people. This is a massive problem that we need to solve. Clinicians with burnout are at least twice as likely to report that they've made a major medical error. So there's risk to the organization. There's risk to the patient, obviously. They're more likely to reduce their clinical work hours. They're at least twice as likely to leave their jobs. And they're 5 times more likely to leave medicine altogether, which is just incredible at a time when most projections are, for example, that we're going to have a nurse shortage, that we need more help. We have this massive burnout, and we have people who are just plain leaving. By the way, I don't have it on the slide, but I also looked at the stats for medical students and interns, and the burnout rates are even higher. And then finally, an estimated $4.6 billion in societal costs each year is linked to burnout of just physicians. And that doesn't count all the other healthcare practitioners and people who are out there working. This burnout is a massive problem no matter how we look at it. Even when we look at the organizational level, we see the same challenge, right? Those of us, and we work with a lot of people who are in healthcare HR, who are focused on culture, who are focused on trying to support the amazing work of these caregivers, and they're burned out. They're overtaxed with increased pressure on costs, rapid policy changes, quality of care, constant technology change. It's just really overwhelming to try to keep up with it at the organizational level. And so we're all in this same boat, this sort of cascading burnout struggle. This struggle to meet the needs of all of our healthcare professionals and to be able to keep them from burning out is costing everyone, and of course, most notably the patients, right? As my story sort of illustrated. We need to do something about this problem. This is something we all know. But what I want to pivot to now is not to another tactical solution or technology solution. That kind of tactical maneuvering isn't going to help the problem that we have in meeting people's needs. As a matter of fact, in some ways, it's contributing to it. We keep implementing more and more systems. Even healthcare professionals in HR have sometimes 5, 6, 7 systems that they're working on. The EHR, the electronic health record, is supposed to be heralding all kinds of benefits. And it's not that it doesn't have benefits, but it is, by all accounts, contributing a lot to pulling doctors away from patients, healthcare people away from patients, and contributing to burnout. So this sort of tactical decisions around platforms and software and technology and policies isn't going to help. What we need is we need a higher order approach to this problem in order to bring real change. We need to get back to the heart of this issue. And so I think what our mantra needs to be, and what needs to move us forward and into the choices that we make about everything we're doing to implement change in healthcare for the benefit of our employees and for patients, is to remember that we can't meet the needs of others unless our needs are met. It's a very simple truth that we all know. It almost sounds like an aphorism, but we need to take a breath and remember this. We can't meet the needs of others until our needs are met. And our needs are not being met. The needs of our employees in healthcare are not being met, and as a result of that, the needs of our patients aren't being met. And it's just common sense. Now, the flip side of this is that when our needs are met, that fuels our capacity to help others. And again, we all know this intuitively. I think about I can think about this in any domain of my life, but the one that always pops to mind, because she's always on my mind, is my daughter. And I know I spend a lot of time with my daughter, and I know that there are times when I'm just not, when I'm burned out, when my tank is empty, I can't be as patient, I can't be as present, I can't be as listening. We've even had conversations about it. It's like, you know what, Erica, let's not work on your homework at 8 o'clock at night when my tank's empty, because I'll be less patient and I won't understand the new math as much. We need to work on this earlier. So we know that when our tank is empty, we can't be there for the people that we care about and that we want to be there for. And so this is a very intuitive truth. We need to make it real in our healthcare organizations, right? We need to focus on need fulfillment. We need a need fulfillment framework that can guide us through everything that we're doing. So let's talk about that. Let's talk about how can we solve this with a need fulfillment framework. What would an ideal need fulfillment framework look like? So what I want you to do is I want you to imagine a framework for understanding and supporting the needs of your employees and of patients that, number one, we could tuck in our pockets. It was really portable. It wasn't just another set of 500 metrics and graphs that we would look at and try to understand, but instead would clearly pinpoint the core needs, the ones that are most important to both employees and patients. We're all human beings. Let's have one model that can help us understand needs that will drive vitality, success, well-being, and fulfillment for all of us. And let's make that set of things we've got in our pocket based on really behavioral science and deep empirical evidence. We're in healthcare. We're in the sciences. It's a mandate, actually, that we be doing things based on evidence. So, of course, this ideal model would have a strong evidence base that these are the things that are most important. Second, we want these needs, these things we're going to be tracking and focusing on, to actually be applicable everywhere, to be applicable to the people in our accounting departments, to the ambulance drivers, to the surgeons and the doctors, to the nurses, to the people in varied geography and varying disciplines. We want it to be universal, and we want it to be strongly predictive of the outcomes that are important across the board to all stakeholders. We want these things to be predictive not just of patient outcomes and of people feeling more engaged, but actually predictive of the organizational outcomes as well, being able to save costs and work more efficiently, more productively with reduced risks. We, of course, would want these things to be quantifiable. We need to be able to track these things. We need to be able to know where our strengths and weaknesses are. We need to be set up with quantifiable data so that we're in a great position to do something about it, right? To engage in training and intervention around our weaknesses. And that leads to the next thing that this ideal framework would have, which is it would enable tangible action by actually prescribing proven best practices. Again, from an evidence base, what are the best practices that will improve need fulfillment and support exactly where it's needed. And then just as a last thing, this ideal framework, I think, would include everyone in the process of learning and need support, including everyone, every employee. It's not every department head, every frontline manager, every patient, that there would be something in this model that would resonate and speak to everyone, that we'd have a shared language and tool set that would simultaneously help to improve both the employee experience and the patient experience alike. This would be a great tool set to have at the ready that we could use to guide so much of what our struggles are. When we're evaluating new systems, how is that new system supporting or thwarting around this core set of needs? Right? How can we be tracking this, making decisions, intervening, providing support where it's needed? This is the kind of need fulfillment framework that is at that higher order level and can break through and cut through the spiral we're in right now around wearing out all of our employees and the people working so hard for patients. I want to put forth a candidate framework that fulfills, that ticks these boxes, and talk a bit about that and strongly advocate for it as something that you begin to think about in your organizations. And that framework is called self-determination theory, what I want to call a self-determination theory framework. Now, I wouldn't be surprised if a lot of you have come across self-determination theory if you study behavioral science, as I'll get to in a minute. It's really been growing. It's been on the rise, particularly over the last decade. It is a behavioral science model, quantifiable behavioral science model that is focused on all the things we're talking about, looking at our basic needs, our basic motivators, and the things that drive well-being, performance, and success within each individual. It was started by my partners here at Motivation Works back about 40 years ago. I joined them shortly after that, back in the 80s, and began working in the model first as their student and then as their colleague. And what we've seen is the world in many quarters really embrace this model as the approach for meaningful change, for meaningful motivation, and for meaningful ways to impact people's lives positively. This is just a chart of citations in the theory from Google Scholar, but just to kind of show a little bit of the really incredible growth. We're now up to the point where self-determination theory is referenced in some publication 100 times every single day. And so this is why maybe some of you have heard of it. I want to go over the fundamentals of that model. We have limited time today, but I want to go over some of the fundamentals of that model because they speak directly to this issue of need fulfillment. In fact, self-determination theory defines as one of its core tenets what are the most important, what's called basic psychological needs. And they're called basic psychological needs not because they're simple, but because they are fundamental to everyone, that everyone, every single one of us, in the same way we all share physical needs for things like hunger and thirst, we also share these psychological needs, and these needs energize us when they're fulfilled, and we feel depleted when we don't have them fulfilled. Those needs are the need for autonomy, and I'm going to go into more detail on each of these in just a minute. The need for mastery, or sometimes in the scientific literature we call this competence, and the need for relatedness. Let me talk about each of these needs because this is really the crux of the need fulfillment framework that I'm proposing. First, the need for autonomy. Autonomy is the need we all have to feel that we're the authors of our lives. We want to feel that we are endorsing the paths we're on and that we have a sense of choice over our lives where that's possible and where that's not possible, that we feel that we fully believe in the structures or rules or circumstances or actions that we're taking. Um, the reason I define it in that way is that a lot of times autonomy is misunderstood as freedom or independence. Certainly, autonomy is a word that we've all heard. We often hear about letting people work autonomously. And sometimes in organizations that, when we think about it as freedom or independence, that bumps up against the fact that at work, and particularly in healthcare, where there's lots of policies and procedures to follow, you don't really get to act with a lot of independence. A lot of times you have to act within structures. The beauty of understanding that autonomy isn't about freedom, but autonomy is about endorsement. That structure is okay as long as I believe in that structure. I believe in the rules for how something's done, that can satisfy my need for autonomy in just the same way that having freedom and choice can, is very important for being able to work on implementing more autonomy-supportive procedures in industries and circumstances where high structure is needed, like healthcare. And we'll talk more about that in a few examples as we go along. What does autonomy look like in a healthcare organization? Well, it focuses on questions like this. Do I understand how my job contributes to the mission? Again, that's that sense of endorsement that I believe in. I'm on board. I have ownership of what I'm doing. Am I given clear rationales for tasks and policies and procedures? This relates directly back to what I was just saying. If I'm giving clear rationales that I understand and can endorse and get behind, I may not like the structure. The structure might be, somewhat annoying to me, but if I believe in the rationales behind it, I can engage in that in a way that's very autonomous. Are my objections and struggles heard and acknowledged? Do I feel like I have a voice in the organization? Do I have meaningful choice in how I execute my job, where that choice is possible? Are there structures that are in place that I understand, that I endorse, and that I value? Again, I focus on autonomy support and autonomy fulfillment. It's really about respecting the fact that all of us want to feel like we are the authors of what we're doing. And the converse is we don't want to feel controlled and pushed around and manipulated, right? No one reacts well to those words, control or manipulation. Right? We want to make sure that whatever we're doing it for reasons we endorse. The second basic psychological need is the need for mastery. That's our basic need to be successful, to feel we're effective, and to experience growth and development. So we want to feel effective and we want to grow. What does that look like in a healthcare organization? Do I consider myself both effective and skillful at my job? Am I able to do my job and get it done, but also am I skilled at what I'm doing? Am I confident in my ability to succeed? How frequently do I experience wins, or do I feel like I'm always in a situation where I can't feel like I'm doing my job well? What pathways for growth in both skill and opportunity? Skill is something I know how to do well, and opportunity is opportunity to advance or be promoted into new situations, to flex new muscles and experience new skills. What are available to me there? Does the organization support my learning? Relatedness is the third basic psychological need. This is our basic need to feel that we truly matter to those around us. We want to feel that we're respected, that our opinions matter, and that also we're able to reciprocate that caring. Of course, this is an incredibly important basic need in healthcare settings, certainly with patients, but also amongst all of us who are working together in those settings. What does this look like? Well, is my perspective valued? Do I feel like I matter to my coworkers and to the organization? Or am I just kind of a cog in the wheel? Do I feel included in planning and problem solving? Are my ideas and objections heard? Again, all of these are related to that core idea of do I matter? Do I feel I'm personally making a valued contribution? So I have to, by virtue of how little time we have together, go through these things very quickly. But what I will say is that these needs have been battle-tested in thousands of studies over the last 4 decades. A lot of times we'll hear people say, Why are there only 3? Couldn't there be more? Yes, there could be more, but what we found, we've taken a very parsimonious conservative view. What we found is that when you look at, and we look at different kinds of candidate needs that people propose, what we found in almost every case is that those other needs seem to distill down to these core essential ones. What we also know is that these basic needs are the ones that drive engagement, vitality, performance, and fulfillment in healthcare employees. I'm going to get to a couple of studies in a minute and talk through those. I'm a researcher. I'm a nerd. I always like to talk about studies. When I get to that point, I want to let you know that for every study I'm going to talk about today, there's dozens, scores, in some cases hundreds of other studies showing the same point. There's such a rich research base that I hope that some of you will get excited to explore at self-determinationtheory.org, and I'll give you some URLs at the end. But these are the needs that when we think about how do we inoculate against burnout, how do we help our providers to be more engaged and do what they most want to do, which is to care for people in a way that's present and vital. Fulfilling these needs are what drives it. That's what the research shows over and over again. Simultaneously, guess what? These are the same needs that drive satisfaction, healing, and wellness in our patients. These needs are the tie that binds us together. We all share them. And as healthcare organizations, if we focus on them, we are going to simultaneously transform our patient experience as well as our employee experience. Let's get to a couple of these studies that I was mentioning. First, this is one done by colleague Arlen Mahler and colleagues, looking at physicians' work motivation and their occupational health, very much focused on the issues and the problem burnout. And here we could see I've kind of simplified this and pulled out a lot of the numbers, but just shown the strong relationship. When you have high need fulfillment, you've got highly significant, those little asterisks are a highly significant mark for better general health, better work satisfaction. And here's the inoculation against burnout, right? It's high need fulfillment leads to lower depression risk, lower burnout, less likelihood of leaving practice, less likelihood of leaving medicine. These are directionally where you want to be. Of course, low need fulfillment has a similar pattern of results, right? In particular, the smaller hours were less powerful findings, but the big hours, again, are showing that when you have low need fulfillment, this is the thing that's driving that depression risk, that burnout risk, and that work satisfaction. So we've got data here, and as I said, many other places that shows that this really is that ideal model of focusing on the core needs that are going to help us turn around these problems and drive better experiences and better care. When we look in our data across tens of thousands of people in our Motivation Works database, what we know is that basic need fulfillments drive what we call high motivational quality. That's that motivation that's coming out of, that deep sense of fulfillment and vitality in one's job. And we see across the board that when you've got the green bars here are people with that high motivational quality or need fulfillment, they have job satisfaction that is, redlining at the top. They're the ones that are committed and willing to go the extra mile. They're the ones more likely to be loyal, to stay at the organization. And they even have, there's lots of other things that could put on here, but they even have less, days out or absenteeism. Whereas the opposite's true for people with a low MQ. So again, just a couple of examples of the exciting data as this, validating this as that core model that I think we all need. Let me then also talk about the fact that when we support these needs in our healthcare practitioners and in our employees, it leads to good outcomes for the organization, right? This is a study that was looking at need support. Again, don't worry too much about understanding the numbers or what the numbers mean. This is a path model analysis. It's just the arrows that are important here, that when nurses are given more need support, it leads to greater need satisfaction and greater perception of support from the organization, which in turn creates this kind of interlocking web of driving higher personal value in the work, higher performance, and higher satisfaction for nurses. So there are these direct causal relationships and links between supporting these needs and being able to drive these critical outcomes. Just one other, I'll throw up here around this and this idea of leader support. This is going to be one graph, but it's a meta-analysis. It summarizes over 72, not over 72, I think exactly 72 studies across 7 different countries, multiple industries, looking at this same issue, trying to say, is there a global effect around these needs? Remember, one of the things I said that this ideal framework would have was it would be universal. And here we see that same pattern, that when needs are supported, people feel a greater sense for autonomy, competence, or mastery and relatedness, and that in turn drives higher engagement, which leads to an incredibly powerful impact on well-being, inoculating against distress, engagement, and positive work behavior. It's just remarkable how much converging evidence we have on this as a way of supporting healthcare employees and really transforming the entire experience of working in healthcare. All right, let's turn for a minute and talk about how about patients. I like this guy. This guy seems to have a lot of vitality. This stock photo guy that I found. It just seems very energetic. Anyway, how about patients? Well, guess what? I can give this same story. This is the exciting part about patients, right? The SDT framework drives patient outcomes and fulfillment. I'm just going to summarize here for a moment, but again, lots of research behind all of this, that the greater support and fulfillment of needs brings about greater sustained success at weight loss, better nutrition and wellness lifestyles, a strong improvement in adherence to medications and prescribed treatment. Think about just how any one of these, I'm going to talk about the adherence one in a minute. These are all multi-billion-dollar problems, right? And that people are constantly looking for a way to transform them. This model can transform them all, right? Greater overall health, greater satisfaction with healthcare providers. And again, I'm using causal language here. Some of you will notice that I'm saying it drives this and it brings about. I just want to say a lot of times people throw those terms about a little too glibly, just because there's an association or a relationship between one variable and another. In this case, we do have a lot of studies looking at things through correlation, but there are hundreds of studies that have been done as empirical studies with control groups that prove out the points that I'm making in order to back up that causality. So there's this great evidence base that healthcare can put its arms around. I want to drill down a little bit more, though, to talk about why this is working. Again, a lot of times in the kinds of webinars we're doing, people will talk about this exciting model and how it's associated with this. And the question is, okay, well, how does that work? Well, why does it work? Well, let's take medication adherence as just an example, right? When we're looking at the issue of medication adherence, again, we're going to focus on those core needs. Providers will support the patient most and will support patient autonomy and mastery by engaging in very specific best practices that support those needs. Providing rationale, discussing choices, ensuring understanding, and really focusing and having in mind and having, as I said, those ideas about the most important needs that you've tucked in your pocket, keeping best practices in mind and how to support those things. When that happens, that drives patient experiences that are higher in motivational quality, right? They understand their rationales, their needs are supported more, they have higher motivational quality, and they feel greater support from their provider. That in turn leads to improvement in the adherence. In some studies, as much as a 400% improvement in adherence, and in this case, I think to medications, along with improved health and satisfaction as a result of there being this experience of having needs supported by the provider. And what's great is that in every single area, we can break this down and show how to do it. We can train in how to do this. And we can also measure the experiences that patients are having and that our employees are having in the workplace so that we can create a virtuous cycle where we measure the experiences, we see where there's need for training, we apply the training, and we improve this need support in a way that drives positive outcomes. So this is really the tie that binds providers to patients. It's the support for these needs, autonomy, mastery, and relatedness, that really is at the heart of the most successful and fulfilling provider relationships. I've got one more little graph here, which is, again, when we look at when people have low need support, these are patients with low need support. Only about 1 in 3 report improvement. The majority are not going to recommend a provider. But when needs are highly supported, you see 7 out of 10, more than 7 out of 10 reporting improvement in their symptoms. Almost 100% recommending their provider. This is the substance of connection, right? That really characterizes why we're in healthcare in the first place. So all that sounds hopefully pretty good, but it might sound a little bit aspirational. So let me go one step further, a little bit into some tactical things, which is that this is a framework that's ready to be put to work, even in the way that it's structured. First, it's well positioned for practical implementation and success. Couple things to note here. Number one, it's very approachable. I'm sure that when I talked about autonomy, mastery, relatedness, these are concepts. I can tell you I've been doing this for decades, talking to people at all kinds of levels, all kinds of people, and everybody gets it. They're easy to grasp. They universally resonate. They should, right? If there are basic psychological needs, that's what should happen. As a matter of fact, one of the things that we often joke about is how you could be giving this conversation about employee engagement or engagement. We do this in lots of different contexts, and almost inevitably somebody will come up during a break in the talk and say, hey, I think I can apply these things to my relationship with my kids. Like, people get excited about these as kind of this global thing that they could be applying in their lives. Model's also scalable. I've pointed out a lot of data. This is a framework that's established. Every component can be measured, and because it can be quantified, we can scale it. I'm going to give an example of that right at the end of the talk, coming up here in a few minutes. But because it's quantified, organizations can scale it, right? Because we can scale it, it unlocks our ability to be able to give feedback more broadly and deeply and quickly to everyone in the organization. Right? So it has a very, very practical footprint for the organization. I was amazed when we started to work in this space at the fact that there's almost no solution that we saw at the time. We have one now that does this, but at the time we didn't see any solutions that for employee engagement that actually gave a report to the employee. It's called employee engagement, but they were really downstream of the whole process, right? By focusing on their basic needs and by able to do it in a way that is quantifiable and we can generate reports algorithmically, we're able to reach everyone. I don't want to get ahead of myself because we've got an example of that coming up. The third thing is that it's actionable. Again, decades of applied research have tested ways that employees, managers, and leaders can take effective action that all come out of this basic science, right? We can link those actions directly to score profiles. And the last point I want to make is that it's durable. We do a lot of work with change initiatives in organizations, mainly to help organizations understand how the people are experiencing change initiatives. And one thing I know is true is that change initiatives are never ending. Major change initiatives happen in an organization every few years, and there's always minor versions that are iterating around at different spots, right? When you have to rethink your entire, structure or foundation every few years, it can be very, very tiring and demotivating. This model is not going to change. These are the basic human needs that we have, that we've had for, dating back hundreds, thousands of years, most likely, right? I've been doing this work for 30 years amidst incredible amounts of technological change, and I can tell you that the fundamentals of STT are a consistent and persistent foundation for your culture. They're going to be there and provide a lot of support while all this other technology and things change up above it. Very quick example of how this gets implemented. I just want to quickly touch on our Motivation Works thing as we sort of wind up for Q&A. We do have a program that we've launched that seeks to do all the things that we just mentioned during the talk. We start out with a very practical psychometric assessment. A lot of times people say, oh, that's great. How do you measure these things? Well, it's simple. We ask people questions. We use surveys, right? The actual technology behind it is not very complicated. Where there's a science is what questions we ask, right? We focus very much on psychometrics as behavioral scientists. Every survey is not created equally. The surveys that we've created and put into this program, and that I would advise all of you, if you're working on putting together your own types of surveys that do the sorts of things I've described here, make sure you get good psychometricians who know how to do item construction, who know how to create items that have good predictive value, that are informative back to the people that are participating. That's going to make all the difference in having a really good instrument. We're able to get meaningful measures of need fulfillment and a number of other factors in the experience of the employee in about 7 minutes, plus or minus 2. We, in other words, have greatly shortened the painful task most employees have had to go through year after year in their 30 or 45-minute employee annual survey. We can cut that down to just a few minutes. We've got algorithms that are going to generate immediate feedback in that scalable way we just talked about. When an employee who's completing our survey finishes, they immediately get a link that says, get a report with insights for you personally to help you have a better work experience and to participate, in growing in ways that are going to make you happier and more vital and perform better. And they just click a button and that report is there for them, for every single employee. We also deliver feedback not just at that individual level, but at 3 different levels. At the organizational level, we're able to give the kinds of things that are part of a lot of these data analysis packages, but about the variables that matter most, right? Need fulfillment across the organization that they can explore to understand what their overall strengths and weaknesses are as an organization. Every team member, every manager, every department head is also going to get an individualized report that's going to let them react to their own team and the department and get customized feedback, again, from our library of recommended actions that only pulls the actions that are relevant to their score profile. And again, all the individuals are also getting that instant individual survey. So this system has been up and operating for us for a while now, and we're getting just tremendous feedback from it. It's one example. I think that it shows that this theory that has been so remarkably important in so many people's lives can be implemented at scale, even in the challenging environment that healthcare presents to us today. It's one experiential model that's quantifiable, actionable, and predictive. And I think I just want to wrap up here saying 2 things. One is, if you want more information, you can see right here on the slide about self-determination theory. You can go to selfdeterminationtheory.org. And there's access to all kinds of resources. Of course, you can also contact us, talk to us anytime. But I want to finally wrap up by finishing out my story, because this is something that I reflect on a lot every time I'm thinking about the healthcare industry, and I'm thinking about applying our work in self-determination theory to the industry. And that is that when last we left me, I was broken down in the bathroom, crying because I couldn't get the test that I desperately needed. And when I opened the door to that bathroom, when I got my composure and opened the door to the bathroom to come out, there were 3 people standing in front of me. They were waiting outside the door. They'd come out from behind the desk, and they immediately said, "Don't worry, Mr. Rigby. We are going to, make sure that you get this test today, that you get what you need." It was a pivotal moment for me in the illness that I was fighting at the time, and have since been able to largely bring under control and overcome. And I think about the fact that need fulfillment and the things we're talking about today is the critical factor that will empower the people in your organizations and in healthcare organizations everywhere to have the capacity to do for their patients what those people did for me. There may have been an initial failure, but they rose to the occasion. And I think to myself, if we can increase that, because that kind of moment I described is happening all over the world right now. It's happened 1,000 times probably since this webinar started. But a lot of times it doesn't have a happy ending because of the problems we're facing. Let's focus on need support. Let's focus on need fulfillment in our organizations, because that is the thing that's going to be able to fuel positive stories like mine turned out to be. So thank you very much. I think I'll end there, and we can have some Q&A.
All right, Scott, thanks so much for sharing that personal story as well as really good information with us today. And so, folks, that leaves us about 12 minutes for Q&A. If you have any questions for Scott, go ahead and send those over to me using that question and answer box. So, Scott, a little bit through your presentation, we got a little bit of a conversation from a couple folks that what you presented mirrored or reminded them of the work of Daniel Pink. Especially when it comes to autonomy, mastery, and purpose. So could you tell us if you've been inspired by Daniel Pink's work in any way, or maybe if he's even been inspired by you along the way?
Yes. There's a reason for that connection, and that is because Daniel Pink was inspired by our work on this issue. As a matter of fact, the way Dan Pink, who's not a behavioral scientist. He's just an awesome writer. Written a number of great books. He finds topics that are interesting to him. He was looking at this topic, wanting to understand motivation, and he came across our science and actually spent a couple of days interviewing Rich Ryan and Ed DC, my colleagues I mentioned earlier, who founded the theory, who are partners here with me in Motivation Works, and based on those interviews and his just comprehensive look for what was the best science out there, he essentially chose ours and made that the basis for his book, which was very exciting.
All right, awesome, Scott. Good to hear that. Next question that we have comes from Mary. She says this is all compelling given the short survey cycle and reporting back to the 3 levels of the hospital and organization. So her question is, how long has the system been in place and what specific results can you report?
Yeah, that's a great question. Yeah, our platform went live about 20 months ago, and so it is the science behind it is very old, and our kind of like boots on the ground consulting practice with this is about 15 or 20 years old in this space. The technology and the platform is pretty new, but we are already getting results back from these sorts of engagement initiatives or long cycles. We're already getting feedback from the thousands of people we have on the platform. That number one, the ability to get the level of insights at 3 levels, and in particular for individuals to be immediately included, is really a game changer. That it sort of it makes the entire employee engagement initiative, or like I said, the annual employee survey, a completely different ballgame. Secondly, because we have those actions and action planning and prescriptive actions directly in the program. People are reporting that for the first time, they're not just getting a set of numbers, which is what we've heard a lot about, kind of last generation approaches to this. You get a lot of cool numbers, a lot of cool graphs, and then particularly frontline managers, people are saying, okay, well, what do I do now? What do I really do? And so when they have prescriptive actions that walk them through steps they can take that are directly relevant to their profile, it's been amazingly powerful. We had, I just was having lunch last month with a client who said that the insights that they got from the program was able to help them identify a particular subset of people in the organization, particularly who had come in who were early in their tenure that were being completely underserved with respect to both particularly autonomy and mastery needs. They revamped their program and they were able to cut their churn rate in half. And it was really a function of them being able to get insights specifically into need fulfillment. So the platform is relatively new, but we're off and running and getting great results. And so we're extremely excited.
All right, thanks, Scott. Questions are coming in now, so we'll try to get to as many as we can. Next question that we have comes from Paula. She asks, do you find that these needs vary by generation? Since there are multiple generations in the workforce, does this vary from one gen to the next or adjust for each?
Yeah, that's a great question. We get that question a lot. One thing I mentioned in passing during the talk was that, I compared these needs to these psychological needs to sort of physical needs like hunger or thirst. And the best way to think about them is to think about them in that way. So, for example, hunger does not vary by generation, right? Hunger doesn't vary by geography or the usual ways in which we like to segment things. The same is true for these basic psychological needs. They're operating for everyone. They may express themselves differently in certain generations. Like one of the things I hear a lot is we all hear about millennials. I'm not a millennial. You can probably hear it in my voice when I say it. I'm a middle-aged guy. But the millennial conversation a lot of times goes like this. Millennials are different. Millennials care about, having meaning in their work and having purpose. And so we need to focus on these things. And I always have a mixed reaction to that. My first reaction is, thank God we're finally focusing on basic need fulfillment. So, bravo to the millennials for bringing that to light for us. But also, it's not that they have those needs more than other generations. It's just that they're a generation that's talking about it more, or the time's right for them to be able to talk about it more. So we do hear different generations and things being expressed that are different, but this is the beauty of the model. The underlying needs are ones that we all share and are all equally important. And that makes it an incredibly efficient and in some ways simple system to be able to implement broadly.
Good answer there, Scott. Thanks so much. Next question that we'll get to today comes from Caroline. She says that you mentioned those completing the surveys can receive an individual report. She says she's curious what that report would look like versus what the employer receives on a rolled up analysis of the survey.
Yeah, that's a great question. So the individual receives a report that is really giving them feedback and insights into their work experience. It's actually walking them through. In some ways, it's like an interesting personality profile to them. It's not presented to them as in any way, here's where you're performing poorly or doing better. It's not a performance report. It's a self-learning tool, right? It's a self-growth tool. One of the things that I didn't go into in a lot of detail about self-determination theory, but is incredibly important, and I go into detail in some of my previous webinars, is that a core tenet of self-determination theory and something that's been really proven out by the science is this. We don't need to motivate other people. The primary locus of motivation is ourselves. And that really our goal should be, how do we create the conditions and circumstances that allow people to motivate themselves? Every single person, every single employee wants to love their job. Nobody wants to go to work and not like their job. Maybe they've accepted that they don't like their job or they have learned helplessness, but they want to love their job. The individual reports are about that. It's about giving insights that can help them grow and be more fulfilled in their job, which is something everyone naturally wants. Those reports are confidential. The CEO could call me up and say, I want to see Bob's report on. Can't have it. Those are private, confidential reports just for the employee. The rest of the data is aggregated and rolled up in the ways that are probably pretty familiar. if you're using some kind of a business intelligence or dashboarding system. But again, one of the differences is that we're always focusing specifically on the scores that matter most to the outcomes that you choose. In the platform, we're able to integrate outcomes. For example, you could integrate, patient satisfaction as one of your tracking outcomes, and the platform will automatically track what are the key variables that are most predictive of that outcome, so that at an organizational level, you can engage more in those kind of higher level analyses and focusing on making the changes that matter most to what you're driving towards.
All right, thanks, Scott. Let's finish up with one more question. Cassie wants to know if you have any examples of prescriptive actions we can take away.
Yes. Yeah, I'm kind of pausing there because we have hundreds and hundreds of prescriptive actions, and prescriptive actions are often contextualized by whatever the thing is that you're trying to solve. I will say there are some general best practices that I included a little bit of here in the presentation. For example, around autonomy support. If you're trying to support an employee's autonomy, the most important thing you need to be doing is that you need to be listening to their perspective, and you need to be respecting the fact that they don't want to be controlled either by you as the manager or by the rules or by the policies or procedures. They know they can be controlled, and too often managers, whether they know it implicitly or explicitly, know that they can control the employee. They can simply essentially shrug, even if they don't literally shrug, say, well, that's just the policy, or that's what management wants, or that's leadership goals, or that's what we've been told to do. The problem with all those things is those are all pretty uncompelling. I'm sure as you hear them, those are uncompelling. But if instead there's a connection made between what those tasks are, we've been given this goal. I believe in this goal, even if there are parts of it that might be put a little bit of stress on us or are unpleasant, because it really helps us to improve the quality of care that we're giving to this segment. We might not see those improvements for another 6 to 12 months, but I've really spent time talking to my managers about why this set of goals are in place so that I could explain that well to you. And I have to tell you that I'm going to repeat to you what they told me because it was really convincing. And I really want to make sure that you all are on board with what we're trying to achieve, and then we can talk about what your feelings are about it. That doesn't take that much longer to say, but I'll tell you, it's a much more compelling, that providing a rationale and respecting that implicit respect that you're not here to control, you're here to win over an endorsement on the path, on the road that we're going to follow, even in circumstances where there's not choice, right? So, I mean, this is something that I could do all day on any number of the needs. There's lots of general strategies as well as specific strategies, but that's just a basic one that popped to mind that is particularly important around a very important need, autonomy.